We do have some larger issues that are going to take some attention. So I'm going to call this meeting to order, and as always, the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So I'm going to take us through the Finance Committee today. Sonia is, I talked to her last week, and she's going to no longer lead that committee, but she'll still be on the board. Just has a lot going on in her life, and so going to need to find somebody to lead this committee moving forward. So just let everybody know, and yeah, I'm always happy to talk about anything. Okay, so we need to approve the minutes from last month. Properly moved and seconded. Any questions, discussion? All right, all in favor say aye.
Aye.
Opposed say left. Abstentions? Morning, Sarah. You missed the minutes. I know that you'll be disappointed. All right, so financial results, Tim.
All right, thank you, everyone. Hope everyone can hear me just fine. All right, we can go to the, we'll start with it's basically our standard agenda that we have each month here. But let's go to the first page, the next page. Keep going. Oh, there we go. We want to start off with a high-level summary of the month that we had. Our revenue came in at $13.6 million, which was favorable to budget by about $200,000. And we'll go through those details here a little later on. Expenses were unfavorable or greater than what we had originally budgeted by a little over $400,000. Those are explainable, and again, we'll go through those details. The one thing I will point out is that, we're still, there's some timing issues, but we're still favorable year to date on our expenses. You net those two together. I know it's a 0.2, but we have rounding. You'll see on the next page. So we were unfavorable to budget by $211,000, with the actual deficit being about $133,000. The one thing that I want to highlight here, and I don't want to take too many highlights away from the ops and planning group and the ridership report, but we had a great month. 1.2 million riders. A lot of that was tied to CPS going back, and then some service ads that we had, which is great news, and it's just nice to see that ridership come up. Now let's dig into some details here on the revenue side. Our operating revenue was $1.8 million for the month, which was favorable to budget. Primarily that was tied to a favorable line item with metro fares along with the CPS fares. Non-transportation is the same story that we've had in the past. Primarily it's investment income that's bringing that, making that favorable to budget. County sales tax, as everyone knows, we do have a slide on that one, but it was nice to see it's moving in a more favorable direction. We were still unfavorable to budget, but only by $56,000. We had a little bit of a scare early on, but you'll see that it's kind of coming back, and there's a little bit more of a story there that we'll get into. Grants were right on budget. We go down to our expenses. Wages and benefits came in at $10.2 million. That was unfavorable to budget slightly. Still favorable year to date. And a lot of the main driver was a little bit of overtime on that line this month. We have the full impact of the new CBA coming in as well this month. Fuel and lubricants came in at $671,000, which was unfavorable to our budget by about $82,000. That's not really tied to price with our hedging. It's really just an increase in miles and the associated gallons that we used with an increase in our service. Parts and supplies. Really just timing there, we were favorable to budget by $103,000. All other line, we were right at $2 million, which was unfavorable to budget by right at $329,000, driven primarily by a good news story, increased participation at our Family Day last month at Kings Island. And also we had some unscheduled garage work at both Bond Hill and Queensgate. I think it was plumbing at Bond Hill and electrical at Queensgate that we had. Yes?
Quick question. Were we, he's right across from me.
The, was it anticipated that we would see a drop for the Metro Family Day? Do we just not anticipate that much engagement?
Well, we didn't anticipate that much engagement. I think when we have some additional details, Ms. Clark, but I think the increased participation was right at 43%, so a great opportunity with our engagement team. And also from a budgeting standpoint, we didn't budget it in one line item in 1 month. We had it spread out over the year. So I think that's a learning for next year, in which we'll put the Family Day in 1 month,
Okay.
and plan for the added increase that we had.
Okay, thank you. That was a follow-up.
All right, if we go to the next page, we've already gone through the high level. Here is just some details behind this. In the ridership report, still, it's good news here. We're still down year to date by, call it 373,000 riders compared to our budget. But the one thing I do want to point out is on our ridership report, you can see we're at a negative variance or unfavorable variance by 4.1% for the month or for the year, but that is down from 5% last month. So we are closing the gap there with our ridership, and that's nice to see with the CPS and an increase system-wide usage.
This is probably a planning and ops question, but noting that CPS ridership is down about 22,000, even though we added 7th and 8th graders, is that just a timing thing, since we weren't accounting for those students initially, or fewer students riding across the board?
CPS was up for the month.
It's up.
Wait.
Yeah, that's year to
Oh,
date.
I'm sorry. I was looking year to date. Sorry.
We're up for the month, and
If I drank
again,
coffee, I'd say I need another cup of coffee. But
you get some water there.
got it. Thanks.
All right. We go down to the next item with the fares. Really nothing more to discuss here. We've already talked about the positive variance that we had with Metro and CPS fares. Non-operating revenue, again, sales tax, you can see that line item there, and investment income. It's the same story that we've had in the past. Going down to the expenses, the new CBA is already baked in here now completely, so we have that in there. We are seeing we're still year-to-date favorable on our expenses, which means we have less expenses than we had planned. And if you look at the bottom line, I want to highlight that we're at $1.8 million, and we had a budget of negative $655,000. So a good news story there. We're still positive to the budget on that one. And let's go back up to the revenue line for a second. You can see the negative 333 year to date. So year to date, we're still trailing the revenue. A lot of that was tied to the sales tax with the offset with investment income. But just to point out how things are moving in the good direction here, we're negative 333 year to date as of August. And as of the end of June, that number was negative $807,000. So essentially, we've cut that deficit in half in a couple months. So a good news story here at Metro. If we go to the next page, this is our revenue source. It's a 3-month bar graph that you've seen before. It's nice to see the orange CPS here. CPS coming in August. It's great to see this. We're trending in the right direction. And all 3 fare classes, all 3 months that you see here on this page are favorable to last year. Let's go to the next page. And here's our favorite slide. I talk about sales tax here at Metro multiple times each day. It's a topic that we want to dig into, understand more. We are trending in the right direction. You can see that while we were negative to budget by $56,000, that is a small number. And the one thing I'm excited about is it's going to harm us in one way and helpful in another way. We expect the Fed to start their cutting cycle here tomorrow. And this will be the first Fed cut that we've seen in call it 4.5 years. And if I look at my records, we've only had 4 cutting cycles in the last 20 plus years, almost 25 years. So we would anticipate with the Fed cutting cycle, stimulating the economy, more spending locally, we would like to think that there's going to be an increase in our sales tax here, sales tax revenue here coming up, not immediately, but over the next 12, 18 months. So close eye being kept on that one. If we go to the next slide, it's the same story. We've gone through the details. The big pop in the middle was the one-time items that we had with our CBA agreement in July. That popped it up there. If you would back out the one-time items, we're kind of right in line with the other months. And with the red line on the far right, we've discussed, it was Kings Island and the unscheduled maintenance that we had at our garages. Next page is the same investment fund summary that we've had in the past. You know, we had $179 million, which is really close to what we've had in the last couple months. We want to highlight, you know, while this is our cash balance, our investment balance, there are certain obligations that we expect to see, and so we do have those as a reserve and want to highlight those. The top number of BRT project development, was 36 million. In that less amounts paid is what we've paid, so you'll see that trending down. The only other change that we had was on the local match of $19 million. We did increase that $13 million this month in anticipation of some work being done at Bond Hill and Queensgate, along with perhaps of a purchase of some land that we've talked about in the past.
Could you point me to that number again?
The 19 million, it's 19,916.
Uh-huh.
Last month it was $6.9 million, so we increased that by $13 million. Mr. Etheridge.
Thank you.
Go to the next page. This is our common summary when we go through our investments. There we go. Before we go to the investment funds report, do we have any other questions? Yes.
Goodness gracious. Mr. Walker, when we have, we've got several more buses that are now electric. And so do we have, like, is there a percentage decrease when we look at our fuel over last year now that we've added those?
I think that the number, Ms. Clark, would be minimal compared to, it's something that
It's not
to keep
really.
an eye on over the next 3, 5, 10 years.
Okay.
You know, that's when you would expect to see some decrease in the actual fuel.
Okay.
And perhaps there's an increase in electrical usage as well. with those.
Okay.
And currently today, we don't have any fully electric vehicles operating in the fleet.
They're just
We
hybrids, right?
have hybrid
10
vehicles,
hybrids.
Right.
and we track the overall miles per gallon usage rate when we build our budget every year, because that changes every year with technology and so on and so forth. So we look at miles per gallon when we build the budget. So if there is kind of a natural increase in overall fuel efficiency of the fleet, that gets captured every year when we sit down to do our budget.
Thank
Great
you.
question.
And if we go to the investment of funds report, it's really the same story that we've had. We're trying to keep an eye on the curve and invest the funds that we can. But we do have to be cautious and make sure we don't go too far out in the curve. And because our investment policy does prohibit us from investing in funds knowing that we can't hold them to maturity. So we've got to keep a close eye on our plan and our spending going forward. We're also seeing a decrease in anticipation of the Fed cutting. Just to give you some numbers here, if you look at a 2-year bond as of the end of July, it was 4.34% for the Treasury bond. 2-year bond as of the end of August was 3.93, and as of last night it was 3.55. So we're seeing that decrease. So it's anticipated that our investment income will be going down, just because of the fact that we the rates are decreasing over time. When you look at our investments, our average maturity weighted to maturity is about 1.67 years. The longest investment we have is going out, almost 4 years right now. If we go to the next page, this was our operating fund. The MTIF, same story. MTIF fund is right at $126 million. That's up from last month. Primarily, the increase is due to the sales tax revenue that the MTIF fund did receive. Same story here. Yields are still good compared to what we've seen in the last few years. But I do think you will start seeing this trend down, which is anticipated. Any questions on the Finance Committee and Finance Report? All right, thank you, everyone.
Thank you very much. I think we're basically seeing, yeah, I got you. So we're seeing not a huge change in overall trends. We're getting back to last year's on sales tax, like matching last year, but not seeing an increase yet. We're still 3 months behind.
Well, as the one thing too, Mr. Etheridge, to keep we were like 1.5% higher in May, which is we have a 3-month trailing window here.
Yeah.
So we were about 1.5% higher than we were last year, in our
Oh.
sales tax period, the
Were
same
we?
period from last year.
And just to clarify, that's without adjusting our estimates from UC, right?
That's correct. These adjustments are the same.
So
I
that's
think-
fantastic news.
We're ahead of priors, but still below projected.
Correct. And if we recall, I think the UC projection initially was 124 million for the year, and the revised projection came in at 118. So we are, as I mentioned, it's something that we talk about and think about every day.
Yeah.
Keeping a close eye here.
And
So it-
hopefully, like tying that to the interest rates, hopefully that means
would
an
like to-
increase
you
in
would-
spending in Hamilton County.
You would think that we have somewhat of a natural hedge with that, with the rates going down, increase in usage, but we'll see. We're keeping, like I said, a close eye on this, and I'm probably a bit more optimistic than a lot of people when it looks at our sales tax, thinking that the simulation we'll have with the Fed cutting and what we'll see in the next 6, 9, 18 months.
Okay, so we'll keep an eye on that. We're not even halfway through the year in terms of actual
Correct.
receipts. We're likely going to see some decline in investment income, and we moved a significant amount of money into the local match.
Correct.
Those are some of the biggest changes from this month.
Correct.
Okay, great.
Yes, sir.
Thank you very much.
All right.
I just wanted to sum it up sometimes. There's so many different numbers, things to keep an eye on.
May I ask a question?
Yes, you can at any time.
Two questions. What's our fiscal year? Was it January through December?
Yes.
And second question is this: fuel. Do you put that out for bid, or you just buy from one source?
That's more of an operational question. Mr. John?
Yeah, we do put that out for bid. We do have several different suppliers coming in at different times, right? As part of our whole hedging program. So yes, not locked in to one source. We certainly put it out for bid.
It depends on the fuel too, right? So we're hedging diesel right now, but then in terms of normal gas, we'll be switching over to that once our project is complete, where we'll have a fuel tank for
How many units do we have?
gasoline. Vehicles
A little over 300.
for revenue
Three,
vehicles.
yeah, revenue 300, 300 big, fixed route buses, and then we have smaller buses for access. You can go now.
It's good to have somebody on the board who manages fleets, knows fuel, knows all that trucking experience, because it directly correlates, and asking these questions is important. And getting into that, I think we've long talked about how we've improved our fleet significantly since the tax levy. We're right at the sweet spot, I think, right now in terms of fleet age, whereas we were running some much older buses before. But watching all that is important for rider experience, for safety, for all kinds of elements. And I'm certainly very excited about the changes in gasoline whenever. We'll talk about when that's going to be done. I always want things done yesterday. So, all right, we do have to approve the investment of funds report. Anybody want to make that motion? Pete, moved and seconded. Any discussion? All in favor, say aye.
Aye.
Opposed, say left. Abstentions. All right, the investment of funds reports passes. We have two things to consider. One is a revised SORTA travel training policy, and then the second is the healthcare plan.
Morning.
Adrian, thank you.
So real quick, the last time the travel training policy was updated was in 2013. So we've gone in and taken a look at the policy and made some updates and some clarifications around the approval process, the expense process in terms of the approvals that employees and you as board members would need to follow. The more significant changes that we made are that we recently implemented a new P card process, and so that all flights, all registration for conferences, and any lodging have to be booked now on that P card or utilizing that P card. Additionally, another significant change we've made is around cash advances. We used to give cash advances for people for meals and things like that in advance of travel. Now you have to pay the cash, pay for the expenses, and be reimbursed the per diem when you return from your travel, submitting your expense report. And we've also added some clarifications around making sure you're booking the most economical expense as it relates to either traveling by air or car rental or your personal car. Whatever you decide to utilize in terms of that mode has to be the most economical version for us to approve your travel. And then just a couple more things around out-of-town travel in terms of time of travel and when you can cancel. So we've just made some updates and clarifications to the policy. Those are just high level, the things that have changed. Most of the policies remain the same. The rest of it's kind of grammatical and just some, we versus shall and may. So with that, I'd like to request approval of the revised travel, training, and meals policy. Any questions?
Just another procedural point to be made here. Typically, this is essentially a procedure internal to the organization. The reason that we're asking for approval, and this is a policy, because this travel and training policy covers the board as well. So therefore, the board reviews and approves this policy. I mean, it seems kind of like an administrative, set of lists that you would find in a handbook, but that's the reason that this policy is in front of this body, because it also affects the travel and meals and things that are associated with the board. So that's why this body is reviewing that today.
When I was looking over the mays and the shells, and then large sections that were new, that seemed all very reasonable to me. I did notice that there wasn't a lot on board procedures, and I was thinking mostly we work with Natalie, and she guides us through what needs to be done. There were some staff deadlines you have to submit within 15 days or 10 days or something like that, which may not work as well with the board and timing. So is that right?
Correct. So all of the paperwork that and the forms and the things that will be updated associated with this policy are the same forms that are used for staff and for the board, right? And so the same type of travel, the same type of reimbursement for training, all of those things are the same in terms of what is eligible and allowable and what is not, and the forms are the same. The administrative folks take care of all of that for the board, but as you're aware, when anybody on the board travels, the board chair is reviewing and signing those forms. When the CEO travels, the board chair is reviewing and signing those forms. So all that is baked in here. Of course, you won't be responsible for submitting your paperwork. We will handle the paperwork on behalf of the board, but it follows the same process.
Just want to make sure that was clear.
Yes.
Yeah, and there are travel opportunities for the board to APTA or meetings that can enhance our skills. There's even a board members conference for APTA. Not this year, it's next year at some point. Is it in the summer? Yeah. I was looking at the 25 schedule and it was not yet put out there. So these can be really helpful. I went to the one in Seattle and was able to look at some BRT. That was incredibly useful as we're looking at our projects moving forward. So just know that that's out there, or potentially other opportunities. Any questions or concerns about this? All right, I'm going to move that we approve the SORTA travel, meals, entertainment policy.
Second?
Properly moved and seconded. Discussion. All in favor say aye. Aye. All opposed say left. Any abstentions? All right. So here's the big one. Health insurance for 2025.
So good morning, everyone. My name is Vicki Barker. I'm the Director of Human Resources, and I will be doing the healthcare presentation. And you're right, it is a big one. I do have here with me our brokers, Hub, formerly known as Haran. So that is Steve Ash and Cassandra Rending, in case we have any real detailed questions at the end of the presentation. So I just want to kick this off with an update of the 2023-2024 plan performance. We'll talk about our great partnership with EMS, Enrollment Management Services, and then we'll jump into 2025, where we will cover the medical renewal overview, the projection, the stop-loss renewal. United Healthcare will be our vendor, and we'll talk about those features. The employee contribution impact, that's been included in your presentation. I won't discuss those details, but you have those details. We'll talk about the medical recommendation, the dental recommendation, the 2024 new and continued healthcare initiatives, and our healthcare calendar. So for 2023, our plan ran 111% over, and we saw a huge deficit, and this was largely based on some high-cost claims over $100,000. We saw the same trend in 2024, again, as a result of some high-cost claimants over $100,000. In 2023, we had 12 large claimants over that amount, and in 2024, we have in 2023, we had 16, and in 2024, we had 12. Again, the overall increase in the cost is 11.7%. That partnership with EMS, next slide. Enrollment Management Services, that partner with EMS continues to be a very strong partnership. They work directly with our team members to facilitate alternative insurance options. We have them participate in every open enrollment. Any employee who is terminating their benefits because maybe they're getting on their spouse's plan or who's aging out, either through Medicare or over the age of 26, we introduce them to EMS. That partnership works really great. We have 276 employees currently participating in that program, which is up from 248 from last year. If you look at the numbers there, the ROI on that is 267%. Next slide. So let's get into the cost. It's pretty clear that, we are seeing a pretty significant increase of 11.7%, and again, largely due to high-cost claims and what we anticipate a projection in our stop loss. Next slide. When we take a look at the projection for the number of enrollments, our projection for 2024 was 732 participants, and so we are looking at 760. And year over year, our 2024 budget to 2025, again, that 11.7% increase. It's important to note that our stop loss insurance has not been finalized because they do require financial information through August, and that information is still coming in. So these numbers are a little bit preliminary, but we feel very comfortable that 11.7% is about where we're going to stay. So the financial guardrails. Next slide. When UHC approached us several years ago, they came in very aggressive and offering like the best of discounts. And there was a program called an aggregate share program in which they split the cost of claims 50-50, anything over $100,000. And they did that because they were so confident in how they could manage their claims. Well, long story short, it worked in our favor because we saw almost $1 million back in claims costs coming back to our bottom line. But as a result, they kind of lost their shirts, and they're no longer offering that aggregate share program. And in fact, they're not even offering that to new clients. And so we took advantage of it, and, we'll just have to move on. Next slide. Our United Health engagement nurse. I think by now you all might know Allison Connors. We are going to continue with that relationship. She is dedicated, full-time on-site resource. She is everywhere. She takes every opportunity to meet with our employees. Even this week as we do town halls, she is at every single town hall, meeting with our employees and sharing information about, how she can provide wellness support. Our focus areas continue to be prevention care, education, understanding the UHC resources and tools that are available, and of course the chronic condition management, which is diabetes, musculoskeletal, heart disease, hypertension, those kinds of things. And her key metrics for 2024 year to date, she's had 309 individual sessions and 140 unique employee sessions. If Allison were here, there would be multiple testimonials about all the good work that she's doing that is really just changing the game for us. Next slide. The recommendation is to renew with UHC for medical, pharmacy, and stop-loss administration. Dental care coverage. We did need, there was a need to move from Dental Care Plus. That contract expired. We worked with our brokers because Dental Care Plus had been acquired multiple times over the last few years. And so we had lots of insurance, or lots of dentists dropping them all over the place and just poor claims management. And we saw a lot of employee complaints about it across the board. And so they went out and did a bid, and Delta Dental came in very aggressive, giving us a 3-year rate guarantee. It is a 10.6% increase, but it does have the same plan design, same expanded network. So for January 1, we are rolling out a new voluntary long-term insurance for all employees, so there's no cost to Metro other than just us administering it. Again, our dental carrier change will be Delta Dental. And of course, we'll continue the chronic disease management programs that we have in place, and we're looking at some new ones as well. We will also continue working with Allison. We partner with her monthly for a focus on different wellness activities, everything from, sun protection, summer safety, diabetes, immunizations, you name it, we're out there promoting it and talking about it. That strong partnership with EMS. Even EMS was at our town hall meetings. Nicotine cessation programs, the biometric screening, that is where our employees can get that wellness discount if in fact they participate in that blood draw and they have a preventive wellness exam. If they participate in that, it's a 30 to 40% decrease in the cost of their monthly premiums. Flu shots, mammography, we're seeing record numbers as a result of Allison and her engagement with our employees in terms of women participating in the on-site mammographies who've never had mammographies, right? And of course, with TriHealth EAP, we have a strong partnership with them. Our healthcare calendar, obviously we need board approval. We are going, one of the things we're going to be rolling out is a benefits app. So my team and I will be out at the garages and the locations to talk about what that app looks like. So at your fingertips, you can get to United Healthcare, you can get to Delta Dental, you can get to IMED with just one application. Biometric screening is October, November. That'll be on-site and at LabCorp. Open enrollment is October 21st through November 2nd. And then the physical information is due by November the 25th, and then the plan year begins January 1. Thank you.
I'm sure there's several questions. I'm going to start off. I was actually interested in the next slides. How does this affect our employees? What change are they going to experience?
So they are going to see a slight increase, but it is minimal. It is minimal when you take a look at the cost of healthcare. We still are shouldering the major cost of it. The employee cost is 10%. And so, we're bearing the 40%, but the 90%. But it is going up just slightly, just a few dollars. So minimal impact in terms of biweekly deductions.
Okay. So what's the impact on our overall budget when you distill it all out for next year?
Well, you talking about dollars or just increasing?
Dollars.
Dollars?
Can I add on a question to that?
Sure.
Dollars. So are we the 50% loss of the 50% match, right?
Yes, the
How
average
have
share
we-
program.
Yes. How have we budgeted that in here? I missed that.
I don't
So
think
the
we
premium's one thing, but like the potential sharing that's lost, how is that included in these numbers?
So from a budget, you want me to talk about budget?
Yeah.
Vicki, so from a budget perspective, we will budget and anticipate it. We're self-insured, right? So what you'll see in the memo is there are essentially fixed costs that are going to go up. So our administrative costs and our stop loss costs are going to go up, and those are going to go up by $20,000 and about $200,000 respectively, right? So that's a $220,000 increase in the premium for that stop loss, and then the bottom, which is the administrative piece. Everything in between is claims, right? Since we're self-insured up to that $100,000. So we have to estimate what we believe our claims to be, which is this 14.6 figure that you see on the screen here, right? So when we go to build the budget, we're going to be building that budget off of the total number, right? But we won't know what that 14.6 number is until claims come through for 2025.
Right. 90/10 is still good. I mean, it's good because they're going up higher than that.
Oh, yeah,
The employees paying more than that. So
absolutely.
staying
Sure.
at 90/10, goodness, it's a good deal.
I didn't see
It's a good program.
This gentleman's computer might have really worked too well. What's it cost per employee? What is the full cost?
The current budget right now is 18,829, and the projection for 2025 is 20,017 per employee.
And of course, I noticed your family, that once you employ somebody, a family member can come on board, am I correct?
Correct.
Now, is there a charge for that?
No, we do not have a spousal carve-out.
So for EMS, I think it was EMS you mentioned, like we pay them 80 grand a year.
That's correct.
To help people, families get off of our self-insured program, right?
Correct.
For other options that are available. But we
Correct.
don't have the spousal parity written into our contract. The spouse doesn't have to take
Correct.
their insurance. Okay.
Correct.
And the ROI on that you said is 1.5 million for that 80 grand that we pay.
Correct.
And it sounds
260.
like our person at UHC is awesome, right? Our nurse.
Our nurse is awesome. Our
yeah.
nurse is awesome, and our partnership with EMS is also awesome.
And that $80,000 fee, is that a one individual there? What is
Now,
that charge?
the nurse fee, it is one person, the nurse fee. The total cost of the nurse is $165,000. The first year, United Healthcare covered the whole cost, and I think now our cost is about 65 grand. Is that right?
So are those different
EMS
things?
is a different vendor.
Different thing. Yeah. Okay.
Two different vendors.
So EMS, who gets paid the $80,000 to administer this?
That's EMS. EMS.
Like one individual there that navigates this?
Yes, we have an account rep that comes in regularly and works with us.
What is an opt-out credit?
80 grand a ton.
The opt-out credit is $150 for single and $350 for more than one. It's paid out monthly.
I mean, it's small potatoes.
One last question. I'm kind of new to the board, but I've ran a trucking company, so I kind of went through a lot of this.
Okay.
You said you had 15 people at 100. There were 15 incidents where they're $100,000.
Mm-hmm.
Give me an example of $100,000. What was that? Did they fall off the bus? They run over the bus, or what was it?
Cancer.
Oh, okay.
Yeah.
Okay. Was it attributed to the fumes from the bus?
Not necessarily. No, not that we're aware of.
That's
That
what I
would be
got
that would be
hit with.
workers' comp. So that not necessarily. Yeah, not that we know of.
Other questions, concerns?
Sure.
You mentioned that dental is changing, right? Different dental provider.
Yes.
Are employees going to see an impact as far as which dentist they're able to?
It's
go
an
to?
it's an expanded network. That was one of the things that we took a look at. So we see minimal disruption, if any at all.
So, correct me if I'm wrong on this. Well, thank you very much. I really appreciate the presentation and the slides and being able to go through all of that.
Absolutely.
I know this is like the culmination of an immense amount of work. And of course, then immense amount of work in the weeks to come as well. So thank you
Yes.
so much for
Yes.
everything you're doing.
Yes.
I just wanted to summarize, make sure I'm having the right perspective for the board. So we're looking at just short of 2 million anticipated increase in healthcare expense for next year. And then we were going over our revenue, sales tax revenue, more or less flat at this point with some potential optimism from last year. And I think it's important that we realize those movements. Got some significant increase to cost. We're not seeing yet increase in revenue. Maybe some other sources of revenue, but in terms of our primary one, sales tax. So let's keep that in mind as we move forward. Yeah, did I get anything wrong there? No, okay.
I think Allison should be added to the good news presentation.
Yes. For planning and ops. Yeah, there should be a good news for finance too.
Right.
Investment of funds report, is that what you're saying? Okay.
Right. Right, good news.
I think we do need to move this on to the full board. And so I would entertain a motion.
So moved.
I heard Chelsea first, and Neil, would you like to second?
Sure.
Oh, okay. Sorry.
I'll get the
All right,
next
Neil.
one.
Well, properly moved and seconded. I think we've had a lot of questions. Any discussion? Last chance. All in favor say aye.
Aye.
All opposed say left. Any abstentions? Once again, thank you very much, Vicki.
Thank you.
All right. Sorry. I think that gets us through all our items. Am I right? Is there any new business? Hearing none. I think finance is done. Planning and ops.
Okay. Thank you, Mr. Etheridge. We'll move right into our agenda. There's food and drinks over there if anybody needs to step over during our meeting, but we'll roll right into it. We've already done the Pledge of Allegiance, so we can skip over that point. Hopefully, everyone's had an opportunity to review the minutes from the August 20th meeting. I'll entertain a motion to approve. Ms. Clark, thank you. Mr. Metz seconds. All those in favor signify by saying aye.
Aye.
Opposed? Okay, so the committee minutes are approved. At this point, I'll make a motion that we go into executive session. The reason being, under Section 121.22G3, conferences with an attorney for the public body concerning disputes involving the public body that are subject of pending or imminent court action, we need to go into executive session to work on that subject. Is there a second? Ms. Robinson seconds. All those in favor signify by saying aye. Aye.
Is it a roll call?
Roll call.
Roll call.
Sorry.
Ms. Clark? Yes. Mr. Driehaus?
Yes.
Mr. Etheridge?
Yes.
Mr. Kelly?
Yes.
Mr. Metz?
Yes.
Ms. Moss?
Yes.
Ms. Robinson?
Yes.
And Ms. Sheets?